What are the treatment options of renal failure? Depending on the type of disease, treatment modalities are different. Firstly, one should identify whether renal failure is acute or chronic, or acute on chronic. If it is acute renal failure, then appropriate and timely treatment can save the kidney and prevent future incidents of any permanent renal damage. On contrary, if it is chronic renal failure, there is permanent damage to the kidney, hence the treatment options are limited. There are two treatment options: 1. Conservative management, to delay progression to ESRD, end-stage renal disease. 2. Renal replacement therapy, RRT, when ESRD is reached. RRT are of three types: hemodialysis, peritoneal dialysis, CAPD, renal transplantation. 1. Conservative management. The main target of conservative management is to slow down the progress of kidney disease. When chronic renal failure, CRF, is diagnosed, nephrologists try to identify the native kidney disease, which can either be caused due to diabetes, diabetic nephropathy, hypertension, hypertensive nephroclerosis, or other glomerular and non-glomerular diseases. Once the cause of renal failure is detected, the goal of the therapy is to control the factors that stimulate the progression of chronic renal failure. Besides, there are also other medicines that have been found to delay CKD progression. The principle of conservative treatment does not solely depend on medicines. There are two other factors, namely, diet and lifestyle modifications. The sooner the chronic renal failure is diagnosed, the better. A nephrologist gets time to delay or halt the progression. Hence, early screening is the best way to prevent progression of chronic renal failure. 2. Renal replacement therapy. When both the kidneys stop working, we require some mechanism to supplement the work of the kidneys, in order to sustain life. The three commonly practiced interventions are: 1. Hemodialysis. 2. Peritoneal dialysis, and 3. Renal transplantation. Altogether, these modalities of treatment are referred to as renal replacement therapy. In hemodialysis, blood is passed through a special filter called dialyzer, which purifies blood, and is then returned to the body. Depending on the clinical condition of the patient, it is given 1 to 3 times per week, or more, and takes 4 to 5 hours for each session. In peritoneal dialysis, a catheter is inserted inside the abdomen permanently in the peritoneal cavity, using the peritoneum as the purifying membrane. Through this, dialysis or purification of toxins can be done at home. Peritoneal dialysis is a very good option for those ESRD patients who live far away from the hemodialysis center, or those who do not have any permanent vascular access for hemodialysis. Renal transplantation is the best solution in patients with end-stage renal disease. In renal transplant, the donor kidney is harvested, commonly from a living related or altruistic donor, or from suitable deceased donors. A suitable matched and compatible healthy kidney is placed in the lower right or left side of the abdomen, and is surgically connected to blood vessels and the bladder. A transplant recipient can lead a normal life. One thing to remember, that initiation of renal replacement therapy depends on many clinical parameters that nephrologists evaluate. It does not depend solely on serum creatinine value of the patient. Hence, screening renal function every year is the only way to detect chronic renal failure early.